Hi, I'm Dr. David Coun. I'm a primary care physician and a medical director with the Mount Sinai Doctors Medical Group. I'd like to take a few minutes to discuss what you can do to manage your risk for diabetes. Diabetes is an increasingly common disease in the United States in which our bodies cannot adequately control levels of blood sugar, also known as glucose. Over time, elevated glucose causes harm throughout our body and greatly increases the risk of many serious complications, such as kidney disease, vision loss, nerve damage, and cardiovascular disease. So it's vital to detect and control this condition early on, and better yet, prevent it when possible. The first step in diabetes prevention is understanding your risk. So please be sure to schedule your yearly wellness visit with your primary care provider. They will very likely order a screening test for diabetes. This is typically done with a blood test of your glucose level or a blood test called hemoglobin A1C, which gives us an average measure of blood sugar over the previous 3 months. Prediabetes is a condition in which blood sugar levels are higher than normal, but not yet in the diabetic range. It's a warning sign. It indicates that you're at risk for developing diabetes in the future. The good news? Prediabetes can often be stabilized and even reversed with lifestyle changes. There are several risk factors for developing diabetes, some of which are not modifiable, like family history, but many others that are, such as diet, exercise, weight management, stress management, and smoking cessation. The great news is that studies clearly show that sustained lifestyle changes can slow and even reverse diabetic risk. So what can you do if diagnosed with prediabetes? First, and perhaps most importantly, get some exercise. The goal is a minimum of 150 minutes weekly of moderate exercise, like a brisk walk, or 75 minutes weekly of high-intensity exercise. Even taking the stairs instead of the elevator, or a quick walk after a meal, can make a significant impact on whether you get diabetes or not. Regarding diet, the goal is sustainability, so your changes have to feel right to you. A healthy daily diet consists of small portions, with a focus on vegetables, fruits, lean proteins like fish and chicken, whole grains, and healthy fats like olive oil and avocado. Try to avoid added sugars, refined carbohydrates like those made with white flour, and processed foods. As nutritionists like to say, eat your fruit, don't drink it. Sugary drinks like juice, soda, fruit smoothies, sport drinks like Gatorade, and alcoholic beverages should all be minimized on a day-to-day basis. Increased mental stress as well as depression are also correlated with diabetes, so please seek out stress-relieving activities and appropriate support and treatment if necessary. Finally, cigarette smoking greatly increases your risk of diabetes on top of dozens of other life-threatening conditions, so this should always be addressed with your healthcare provider. Please be sure to schedule your yearly wellness visit with your primary care physician so that you can be screened for diabetic risk. If you've been found with prediabetes, please be sure to follow up with your doctor at least once yearly to monitor this and to strategize about next steps. Thanks for listening, and stay well.